Nigeria's healthcare crisis is worsening as a strike by the National Association of Resident Doctors enters its fourth day. Services across major federal and state hospitals are crippled, leaving patients stranded and families desperate for help. A dispute over welfare and funding remains unresolved, with both sides refusing to back down. Tahnteh Azal completes the report.
For doctors, this strike is a last resort. The National Association of Resident Doctors, the backbone of Nigeria's tertiary hospitals, says years of neglect have pushed them to the edge. Their 19-point demand list includes unpaid salary arrears, promotion backlogs, implementation of the new consolidated medical salary structure, and release of residency training funds. They also want action on the worsening manpower shortage that's forcing doctors to leave the country in droves.
We're supposed to be discussing how the government is going to take advantage of the reverse medical tourism now happening within Nigeria. People are coming to Nigeria to carry out special procedures, cosmetic surgeries, joint replacement surgeries, and all of that. And you're here discussing the general welfare of doctors. In 2025, people are going closer to universal healthcare coverage, and we are still here discussing welfare. It's sad now. It's really sad. I'll just say we hope, we can just be hopeful, while we stand strong, and then expect that whatever it is from this strike action, when the agreements have been made, when the solutions have been proffered, we'll consolidate and then come up with, implementation tools and evaluation tools, and then carry them out subsequently.
The federal government says it's responding. The Health Ministry confirmed that President Bola Tinubu ordered urgent steps to get doctors back to work. Officials cite the payment of 21.3 billion naira in arrears and plans to release another 11.9 billion naira, along with the recruitment of 14,000 new health workers nationwide. But Dr. Okedinachi says the promises aren't enough. He insists the doctors want implementation and not assurances, warning that the system is bleeding talent faster than it can replace it.
We want to work. We have colleagues that have left the country in droves, in their numbers, and then we are still here. So if we are still here, then what does it take the government? Instead of trying to stop people from leaving, why not take care of those that are here? That will encourage more people to stay back and join the system. So that is what we are looking at, We hope that our pleas will be addressed, itemized as we've itemized them, and then each of them will be looked into and addressed accordingly. Most of these things are not based on finance. That's why when they come to the general public and make it about finance, we laugh. These are things that do not require the government to actually sign out money for most of our demands. These are things that the government just needs to sit down, come up with policies, implement those policies, and come up with proper evaluation systems to review the state of these policies when they've started running. That's all we're asking for.
At the heart of this standoff are the patients, many left waiting in hospital corridors, others turned back after traveling long distances for care. Consultants and house officers are running skeletal shifts, elective surgeries are postponed, and emergency units are overwhelmed.
We made them call the strike because of the innocent one, because some of them no doctor, as doctor no dey. Maybe if in emergency come like this, they no go see doctor. Maybe before them go run up and down, that person don't go. So may government still help us, may them call the strike.
As the strike drags on, lives hang in the balance. The government and doctors remain locked in negotiations, but for ordinary Nigerians, the cost of this impasse is already too high. Tahnteh Azal, Trust TV, Abuja.